Hello everyone, welcome to another episode of ANNTalks. I'm Curry Bordelon. ANNTalks is a series for nurses by nurses. Today we're going to talk about resilience. We're in difficult times right now. We're surrounded by a lot of uncertainty. We're related to the coronavirus, COVID-19. We're surrounded by stress and anxiety, inundated with news every day about the unfortunate and very tragic deaths of our family members, of our community, of our colleagues. And it's been very difficult to understand how we can move past this. How do we continue on knowing that we're putting ourselves, our families, and also our colleagues are putting themselves at risk. But there's something to remember. As nurses, this is what we do. This is who we are. We care for others in the face of adversity. We care for those in times of need. We care for those in times of tragedy, such as this. And one of the things that we always get to a point of, whenever we get to a point of moving past something like this, is we reflect. We reflect on, did we do the optimal care for the patient? Did we comfort them enough? Did we provide enough support for the family? We always try to sometimes second guess ourselves. But there's one thing to remember through this whole thing is resilience. Because during those difficult times, during those moments of tragedy, during those times of unbelievable anxiety to yourself and those around you, you find the strength, you find your ability to move past that, to continue on, to move in the motion beyond and to conquer whatever event that it is. Our history is filled with different events, from wars to plagues, pandemics before this, other viruses such as Zika, plus you have Ebola. You have all these different types of contagions that we've moved through. Different political events. We've moved through this as nurses into a bigger, stronger community. That's one thing to remember this as well, is as we continue to move on past this, we will get past this. It may take time. It's going to take more ups and downs, but we are going to get past that. And there are many of our nursing professionals, our nursing colleagues, that understand how difficult this is and understand what it takes to be resilient. They provide you with many opportunities, both in a professional manner, such as the professional organizations, Academy of Neonatal Nursing, American Nursing Association, other professional nursing organizations. They provide you platforms to share stories. They provide you platforms to learn how to advocate. They give you opportunities to strengthen your knowledge of your population. So there's lots of opportunities out there. And what I'm seeing as I'm looking over all these different platforms and professional organizations and conferences that have gone, some have gone virtual now, as we look at these different opportunities, what is it that they can give us as nurses to build our resilience, to build a deeper understanding of what we're capable of, to build that knowledge base, to have us understand who we are as nurses and to be better prepared for another potential challenge in our future. And that's one thing we always do as nurses, is as we move past, like I said before, we reflect. We reflect on what we've done. We reflect on who we are while we're in this. And then we start filling ourselves again with that emotion of satisfaction, filling ourselves of, I do this for this reason, for my patients, for my families, and so forth. So just when you think that there's no other opportunity, that we'll struggle to get past the situation, recognize that we as nurses, for hundreds of years, we've moved past different challenges in our history. Ironically enough, this year is the year of the nurse, Florence Nightingale's 200th birthday. So the American Nursing Association, their motto, one of their elements of their motto is leadership. So how are we leading past that? Well, one way you lead is you advocate for change. You advocate for your population. How do you advocate? There's lots of different ways. You become more involved. You join professional organizations. You maybe become certified. Maybe you need to learn more about your population so you can pay it forward and help educate, train, and strengthen the environment that you work in. So there's lots of opportunities for you to continue that learning experience. For a lot of professional organizations, they've had to unfortunately cancel their normal springtime conferences or meetings or so forth. They've gotten creative. Some have moved to virtual formats. Some have moved to webinar series. Some have moved to free lecture series. So I want to talk to you about a couple of different opportunities that you have. The American Nursing Association has lots of opportunities on their website. There are other professional organizations for different populations that have other opportunities as well. But I want to focus today on Academy of Neonatal Nursing. The Academy of Neonatal Nursing has put together a lot of complementary content. Complementary CNE lecture series is one particular one. So when you go to the website, there's a series of lectures that are available for credit, for CNE credit. So as you continue on, because we're still going to have to maintain our licenses, we're still going to have to maintain our continuing education, there are opportunities to do so at reduced or free costs. So explore what's out there. Go to the Academy and Neonatal Nursing's website. Go explore what they have available to you, both in the certification realm. There's lots of the certification series is there that prepares you for certification exam. It's the ANN certification review course. It provides you a lot of sample questions, a tremendous amount of content, a lot of resources to you, and so forth, so you can better prepare for many different certification exams. So as I want to close today, I really want to reinforce how we as nurses, and I've been in nursing for many years, how we as nurses have moved through difficult times before. And when you're in the middle of something now, it seems like it's never ending. But understand that we will move through this, and we will emerge stronger. We will emerge with a deeper sense of community of who we are as nurses. We are a community of caregivers. We care for our populations. We care for our patients. We care of all different, across the lifespan. But most of all, we care for one another. And that's very important during this time period. Caring for one another, because together we will move through this. Thank you so much for your time.